Breaking news, and it's the kind we don't like. It's a new number threshold having to do with coronavirus. The United States has, in the last few minutes, gone over the 6,000 case mark, the new official number, 6,010 active cases that have been confirmed by testing. Remember, the best guess among public health professionals is this is nowhere near the number of Americans walking around positive. We have lost 104 souls thus far as a country, 6,010 active cases, 104 deaths that we know of. We're joined by Dr. Kavita Patel. She served as senior aide to Valerie Jarrett back in the Obama White House, advising on health reform, economic recovery issues, happens to be a practicing primary care internist at Johns Hopkins. And Doc, I know you heard Dr. Emanuel, and I'm curious, do you agree with his model? We're watching deaths, yes, increase by different factors now. Do you think everything we're seeing today is, as a mathematical property, 15 days behind? And then what will availability of testing do to the numbers?
Absolutely. I think that's a minimum, Brian, that it's 15 days behind. As you mentioned, the testing has delayed so much that not only do we have now kind of a ramp up on testing, but realize that it's not like all of a sudden we now have a test for anyone who wants it. So the numbers that Zeke quoted, I think, are really kind of the floor. And I think we're still trying to understand what the ceiling is going to be.
Your understanding of it as a public health issue, if I landed from a different planet and said to you, Doctor, how many, surely it's just a matter of days until Americans can have what our president promised us from CDC headquarters days ago, testing on demand, in effect. What's your best guess? What's the best thing you could tell me along those lines?
Right. So I think that the best guess, unfortunately, is not days. It's probably several weeks. We have, and keep in mind, Brian, that you've got universities and hospitals all around the country that have been working. They had researchers internally working on tests and had been waiting not only for federal officials to, and really for the president to kind of finally kind of get his act together, but also now we're starting to get shortages on the tests themselves. You talked earlier about the grocery supply chain. The tests themselves have their own supply chain, and we're talking everything from the chemical reagents, which ironically are coming from France and Italy, where we have shortages and problems receiving goods from those countries, also all the way to those Q-tips that we're using to test people's noses and throats. So unfortunately, I think we're still weeks away from understanding what the true impact is, which is why we're not talking about 14 days. We're talking about weeks that we're going to have to change our lives.
Doctor, it's an incredible set of affairs we have to report on here night after night. We're looking forward to talking to you more as time goes on. Thank you very much for your patience and for hanging out to talk with us tonight.